The room I will be doing my assessment in. There are no rubrics that are in sight or that I'm able to use. This is where my iPad will be standing, and this is my patient. Hello, my name is Sarah. I'm going to be your nurse today. How are you doing?
Pretty good.
That's good. Before we get started today, I'm just going to let you know what we're going to do. We're going to do a head-to-toe assessment, so I'm going to be looking at everything from your head to your toe. I'm going to have to stick my stethoscope underneath your shirt and lift your shirt up. Is that okay?
Yep.
Okay, before we get started, can you verify your name and date of birth for me?
My name is Mona Lisa. I was born February 10th, 1999.
Okay. And can you tell me where we're at right now?
The hospital.
Can you tell me why we're here?
I'm an owie.
And can you tell me the month and the year?
It is March of 2026.
Okay, patient is alert and oriented times 4. Before we get started, I'm going to have to get your vitals. Do you know what your normal blood pressure usually is?
I do not.
Okay. Just going to have you stick your arm in here. Just relax. Okay, 130/80 is your blood pressure. Does that sound about right?
Yep.
Okay, I'm going to move on and listen to your heart. I'm just going to be right underneath your shirt on the left side of your sternum, okay?
All right.
Okay, your heart rate is 80 and your respirations are 14. I'm going to look in your ears, eyes, nose, and throat. S1 and S2 were heard on heart sounds. If you just want to look to the left for me or right, it doesn't matter. And the other way. Okay, some cerumen is noted in both ears, but not excessive. Okay, can you look up for me? Mucous membranes are dry and ears are clear. And then can you stick your tongue out and say ah? Okay. Mouth is pink, moist, and intact. Do you have any difficulty swallowing?
Nope.
No. Okay, and then are those your real teeth, fake teeth?
They're real.
Real? Okay. I just want you to look at the tip of my nose, and I'm going to shine this light. Okay. Pupils are equal, round, and reactive to light. Okay, I'm gonna listen to your lung sounds, and there's just 6 spots on your chest that I'm gonna listen to. Every time I move my stethoscope, I just want you to take a deep breath, okay?
Alright.
Deep breath. Okay, and then would you lean forward for me? Deep breath. Okay, lung sounds are clear bilateral on the anterior and posterior on all 6 points. Can you tell me a little bit about your diet?
It's all over the place.
All over the place. Do you eat proteins, vegetables, fruit, whole grains?
A lot of them.
A lot of it. Okay. And then can you tell me about your bowel movements? About how many times a day do you think you go, or every other day?
Once a day.
Once a day. And can you tell me about the characteristics? Brown, black, hard, soft?
Brown and soft.
Brown and soft. Okay. Do you have any no constipation or anything?
Nope.
Nope. Do you have any difficulty making it to the bathroom on time when you feel the urge to go?
Nope.
No. And how much water a day do you think you drink?
Half gallon.
And about how many times a day do you think you go to the bathroom to urinate?
2 to 3 times.
2 to 3 times, okay. Do you get up in the middle of the night to go to the bathroom?
No.
Do you have any trouble making it to the bathroom when you have the urge to pee?
Nope.
No? Okay. I'm going to listen to your bowel sounds, so I'm just going to have to lift up your shirt and listen to your tummy. Okay, bowel sounds are equal times 4. Bowel sounds are active times 4. I'm going to palpate. If you have any tenderness or have any pain, please let me know, okay?
Alright.
No pain?
Nope.
Okay. Abdomen is soft, round, non-distended, no pain upon palpation. And then can you do some range of motion for me? You put your arms up in the air and to the side and out in front of you, and then bend at the elbows and move your wrist. Perfect. Okay, and then can you touch your chin to your chest? Back up, and then when you were moving your head, was there any pain?
Nope.
And then no pain in your shoulders?
Nope.
No? Okay, and then do you have any difficulty swallowing when you take any pills or eat?
Nope.
No? Okay. I'm gonna check the radial pulses. Radial pulses are normal +2, they're equal and bilateral. And then capillary refill is less than 3 seconds in both hands. Okay, and do you use any assistive devices at home to get around or to use the bathroom?
Nope.
No? Okay. I'm going to move on and check your legs and your feet. Legs are cool and dry to the touch, no edema noted in either legs. And then can you pull and push? Perfect. capillary refill is less than 3 seconds on both feet. I'm gonna pick up your foot. Heels are firm and blanchable. And then I'm gonna feel for some pedal pulses. Feet are very cool to the touch, but dry. Pedal pulses are diminished, but I can still feel them, so +1. In between the toes, there's no cracking or breaking or lesions or dressings. There are some calluses, there you go. Calluses noted on the big toes. Can you squeeze my fingers for me? Okay, hands are equal in strength, bilateral, and then can you take your knee to your chest? And the other one. And did you have any pain with that?
No.
No? Okay. I believe that's all I need. Throughout this entire assessment, did you have any pain?
No.
No? Okay, well, that's all I need from you. If you need anything, your call light is here. The bed is at the lowest possible position. Patient has their phone. Do you need any ice water?
Nope.
No? Okay. Well then at this time, I'm done. I appreciate you letting me do my head to toe assessment. If you need anything between now and the time that I come back, please just hit your call light, okay?
All right, thank you.